And welcome back to Talk of Alabama. You know, there's a new approach to chronic injuries that could relieve severe pain. And here to explain how it works and what's involved in the procedure is Dr. Jeffrey Dugas with Injures Sports Medicine and Orthopedic Center. Welcome to you.
Good morning. Thanks, Nicole.
So what is this new approach?
It's basically using the body's own biology to do what it's supposed to do. So we're moving stem cells, we're moving the body's own most powerful cells, the stem cells, which are immature cells, from places where they can be easily accessed to places where they can be usable. So the body can't necessarily mobilize that biology, and we're able to move it from one place to another.
And how does that, kind of in layman's terms, how does it work?
By harvesting bone marrow from, say, the iliac crest, which is the wing bone of the pelvis, which is the easiest access point, we can take the stem cells, we can spin the bone marrow, centrifuge it, so we get a concentrated bone marrow, which is a stem cell rich fluid. It looks like blood, and we can take that stem cell rich fluid and inject it basically anywhere we need it. So it's easy to mobilize, it's easy to obtain, it's easy to move.
And it seems from what I've read and researched, it's not extremely painful, and it's a fairly simple procedure, right? Very
simple procedure. We still do it with a little light anesthetic, so people are a little hazy, they're sedated, but it's a very simple procedure. It's basically 2 needle sticks, so it's not very painful. People don't suffer from pain afterwards. Typically, it's a very routine and very low-risk procedure. It takes about 20 minutes total, so it's a very quick and very straightforward thing.
And we're looking at some images right now on the screen. Is that what we're watching?
Those are the stem cells you're seeing, and all the tissue around it. The cells are the large kind of round things, and they're relatively scarce in certain parts of the body. They're more populous in, say, the bone marrow. So the cells that we're interested in from an orthopedic standpoint are found commonly in bone marrow, and we can take those kind of stellate looking cells and those bigger cells, and we can filter them through a filter as it's centrifuged and get a concentrated bone marrow, and then we can move those cells wherever we'd like to.
Now, looking at that, because it doesn't seem like it'd be very painful, what about the candidates? Who's the best candidate for something like that?
So the people who we really want to look at for these kind of things are people who have problems that don't necessarily heal well. So not everything heals very well. There are some fractures that don't heal well, things like Jones fractures of the foot, scaphoid fractures of the wrist. There are some conditions that we deal with in sports medicine like labrum tears, meniscus tears, even early osteoarthritis that doesn't necessarily have, the body doesn't have a great ability to respond to that. So by injecting stem cells, we may be able to help the body to repair itself. Especially another good population of patients are people who are having something done over. Something that's been done once has to be done again, like a revision rotator cuff surgery, or revision meniscus repair, or revision labral repair, or revision tendon repair. The biologic environment in those cases is not very good. And so in those cases, adding some biology, adding the patient's own biology to that site should help it to heal a little better.
So say a viewer's watching right now and they think, well, we may be a candidate or we may not, but we want to learn more. How do they do so?
There are some good available resources. We will have some stuff up on our website by the end of the week. We also are happy to see patients in the office with that. All of the physicians in our office are capable of discussing this, particularly our non-surgical sports medicine docs. They tend to be the gatekeepers for this, and all of the sports medicine docs in our practice as well. So we will have some information at the Injures website by the end of the week.
Well, speaking of sports medicine, I just got to throw this in for the closing. You guys are really busy right now, aren't you? With
pretty busy.
Football season.
My wife says she's a football widow right now, so it's pretty busy.
So season's what? Another how many weeks do we have?
About another 18 days or so. Not that I'm counting. 17 days. 17.
3 minutes.
We're getting there.
28
a couple
seconds.
minutes. It's good though. I mean, this is a fun kind of work. I mean, the schedule's busy, but it's fun. We have a good time.
Well, injuresportsmedicine.com for more information, or if you want to reach out to the doctor yourself, you can certainly do that. injuresportsmedicine.com. We appreciate your time.
Thanks. I appreciate it. Thanks
for
Nicole.
being
Great
here.
to see you.
More